These fingerprints that are taken are automatically submitted to the DOJ for processing. However, you will get a form given back to you when you get these done, and that is what is required to be submitted with your application. Hi, this is Kelly with the Home Health Consultant. Today we're talking about the types of fingerprinting required for applications in California. If you enjoy our content, please like, subscribe, and share. So why is fingerprinting required for applications? So there are background checks that are required to be done both at the state level and the federal level. Federal level is for Medicare. That's for a CMS requirement. These are done when you have to do your NGS application. For the health department in California, they also require a background check. This is for any owners as well as staff. However, Medicare is only required for owners. When you do your fingerprinting for Medicare, this is the national background check. This is required only for owners, and it is typically done through ink fingerprinting. Anybody who has 5% or greater ownership within the company is required to do this within 30 days of the request. This applies to any applications for enrollment, ownership changes, revalidations, and reactivations. The national fingerprinting for Medicare is typically ink fingerprints. There is a way to do them electronically as well, but there is only one location in the LA area that completes this, so typically people do ink type fingerprinting. These are valid for about 6 months, so do need to be done again if they haven't been done in a recent amount of time. You're going to submit a set, and if the first set is unclear, they do request a second set to be sent. If that set is still unclear and not able to be read, they will then do a name-based fingerprint or a name-based background check. For state fingerprinting, this is done through LiveScan. This is an electronic fingerprinting system. You have to go to a location, a business that has this type of machine to do the specific LiveScan fingerprinting. For the state-based background check, this is required for owners, administrators, and DPCS. This is now only required for home health. However, in the future, this could also expand to hospice due to the moratorium. These fingerprints that are taken are automatically submitted to the DOJ for processing. However, you will get a form given back to you when you get these done, and that is what is required to be submitted with your application. So keep that paper because it is good for about 3 years. The types of applications that LiveScans are required for are initial applications, change applications of any key staff members, or ownership. The electronic fingerprints are very rarely unable to be read. So a redo on these fingerprints is very rare. However, you will be specifically contacted to redo them if required. Costs for the LiveScan is usually around $80 or under, and it just varies by location. And then for ink fingerprinting, we actually offers this service in-house for no cost for those doing an application with us. However, if you do go outside of our company and need to get the ink fingerprinting done, most locations in the LA area charge around $40 or under. So that's an overview of fingerprinting in California for applications. Thanks again for watching. I'm Kelly with the Home Health Consultant, and if you enjoy our content, like, subscribe, and share with anyone else you think would like it.